Hello, my name is PeiZhu Cheng. Thank you, Traditional Medicine Forum, for giving me the chance to share my clinical experience and the discoveries regarding COVID-19. Traditional Chinese medicine and modern medicine have different perspectives and definitions for the COVID disease diagnosis, which leads to different approaches in COVID disease treatment. This has nothing to do with which one is superior or inferior. This has to do with the system and the language you use to do the work. In modern medicine, the COVID disease is an infection whose pathogen is the virus, SARS-CoV-2. In traditional Chinese medicine, the COVID disease is an external epidemic disease from an imbalance due to external and internal factors, whose pathogen is excess wind, cold, and dampness. It is a team of pathogens with three components combination. When addressing COVID disease, you cannot switch systems in the middle. You need to stick with one system for both diagnosis and treatment. The coronavirus used to be as harmful as a cold. So why is it so dangerous and widespread this time? Any pandemic requires three factors: strengthening pathogen, weakening host, and the prime environment for both. Each year has its own character, where some elements may be in excess while others may be deficient. COVID-19 started in winter of 2019, which based on the 5 moments and 6 climates is deficient in Earth, which reduces stores of yang energy and excessive damp in all bodies, both globally and individually. The winter of 2019 did have all three factors. Weakened host strengthened team of pathogens and extreme fierce wind and cold in the environment, as projected in the Yellow Emperor Classic Inner, Huangdi Neijing. The host is weakened by internal accumulation of excess wind, cold, dampness, making the host vulnerable to external wind, cold, and dampness, creating a Trojan horse effect. This makes COVID-19 much more lethal, leading to the coronavirus pandemic. A group of simultaneous pathogens is usually stronger than individual pathogen. In this group, wind is yang pathogen. It is active, moving, and changeable. The pandemic ease to spread is due to this excess wind. Cold is yin pathogen. It damages yang and everything with warming character. It creates external and internal cold. Damp is also a yin pathogen. It damages and blocks yang qi, causing stagnation and accumulation. So this group causes yin excess and yang deficiency in the host. Note that this disease is not caused by heat pathogen. In fact, treating for heat excess actually worsens the disease course. Within this pandemic, the combination of three pathogens attacking three channels. How do we know? This has happened before. A similar phenomenon was described 1800 years ago by Master Zhang Zhongjing in the book, The Cold-Induced Disease, 伤寒论. Master Zhang Zhongjing presented diseases that attack the 6 channels with different side patterns of manifestations in each. COVID attacking involves only 3 channels: Taiyang, Taiyin, and Shaoyin channels, primarily the first 2. This is important because many traditional Chinese medical doctors are confused about which channels are involved and end up mistreating their patients. How do we know only 3 channels are involved? COVID symptoms match the 3 patterns I have shown on this slide. The first group symptom, chills and fever, are common external signs, accompanied with sore and scratchy throat, cough with or without sputum, headache, body ache, joint pain. The severe malaise and weakness are typical signs for COVID from in-pathogen damaging yang qi. These are manifestations of a Taiyang channel disease, which are mainly external pattern. The second group include poor appetite, abdominal cramping and diarrhea, chest oppression and dyspnea, severe malaise, weakness. These are internal symptoms due to cold and damp damaging yang qi, causing spleen dysfunction and lung qi stagnation, which are characteristic of Taiyang channel disease. The third group include lethargy, cold extremities, cold intolerance, profuse sweating with mental restlessness, severe diarrhea and dyspnea, even edema. These are typical signs of Shaoyin channel disease and indicates primary yang collapse. This pattern is what leads to mortality from COVID. I would like to mention that the patient tongue at any point could vary, but usually has thick coating. Based on clarified etiology and pathogenesis, the treatment principles for COVID are the following, and this is important. You must assist yang qi, avoid any cold property herb that damages yang qi. You must match the treatment with the channel pattern of the pathogen. I proposed the following formula, 庚子复阳方, 庚子 formula for yang resurrection. This is modified from 桂枝加附子汤 in the cold-induced disease. In this formula, 防风桂枝 and 羌活 are 3 herbs specifically to address wind, cold, and damp. They are all acrid and warm herbs that enter Taiyang bladder channel, strongly disperse exterior and strengthen superficial yang energy, resolving in Taiyang channel. I will point out the specific combination and pairings in this formula. The first paired herb, 桂枝 and 附子, treat both external and internal cold. 附子 warms internal yang in middle and lower jiao, eliminates internal cold and dries dampness. 桂枝 lifts yang, unblocks the channels, and disperses exterior. These 2 mutually enhance each other. The second paired herb, 八几天 and 防风 eliminates external and internal wind. 防风 expels wind, strengthens and lifts spleen yang. 八几天 calms internal wind and strengthens liver and kidney. This pair is the best option for this particular time because they are the only 2 herbs mentioned in the original Materia Medica, 神农本草经, that extinguish fierce wind. They also mutually enhance each other. The third pair herb, 羌活 and 生姜大枣炙甘草. 羌活 expels wind, damp, and resolves the pathogen in Taiyang channel. 生姜大枣炙甘草 regulate middle jiao to strengthen the earth's function of transformation and eliminate internal wind and damp. This combination eliminates both external and internal wind and damp. Wu-mei is a sour and warm herb. It substitutes original herb Bai Shao in the formula because Baishao's cold property would damage yang. Wu-Mei generates fluid, moistens lung and liver, balances and limits the acrid herbs in this formula from over-dispersing and pacifies wood without suppressing yang energy. This formula needs to be decocted 1 hour. You must decoct foods first 1 hour longer than other herbs without cool downs or breaks in between when using more than 15 grams of foods. 庚子复养方 preserves yang carefully, strengthens yang efficiently by avoiding any cold property herb. So how to apply this formula to the specific pattern? The first pattern is the 太阳 China disease. The symptoms are same as the first group in the slide number 7. Treatment formula for this is 庚子复养方 plus 金匮肾气丸, kidney qi pill from the golden cabinet. This pattern is the most common. If the patient was not mistreated before, 1 dose of 庚子复养方 can eliminate 80% of symptoms within the first day. The second pattern is combination of 太阳 and 太阴 China disease. The symptoms of this pattern are the first group plus the second group in the slide number 7. Corresponding formula is still 庚子复养方 and 金匮肾气丸 plus either 党参 and 白术 for diarrhea. So the whole formula is 庚子复养方 and 理中汤 benefit middle jiao decoction combination, or 麻黄 and 杏仁 for treating dyspnea. So this becomes 庚子复养方 and 麻黄汤 combination. The third pattern is Shaoyin disease. This pattern due to mismanagement. The symptoms of this pattern same to the third group on the slide number 7. If a patient was treated correctly, you should not see this pattern. This pattern leads to mortality. The treatment is different from the other two. There are 2 options for rescue. The first one is 四逆散, frigid extremities powder, light dose, plus 四逆汤, frigid extremities decoction, heavy dose. The second option is 四逆散 plus 白通汤, white en bloc decoction, if there is yin and yang detachment, such as profuse sweating and mental restlessness. To treat this pattern, 致附子 could be increased to 30 grams or more. Here are some more suggestions for 庚子复养方 modification, which you can read on your own. Again, we suggest combining the formula with 金匮肾气丸 for best result to enhance and prolong the effect of 庚子复养方. Modern medicine reports SARS-CoV-2 mutated several times over the past year. Our traditional Chinese medicine interpretations is different. The 3 pathogens interact with different environmental conditions, which can cause changes in activity in each component. For example, cold pathogen could be more active in cold seasons, but inactive in the warm seasons. Dampness could be heavier in humid climates, but inactive in the dry season. This changed the presentation in the different seasons, but the combination of pathogens does not change. Therefore, the formula 庚子复养方 does not need to change even as COVID evolves. My team has been treating and tracking the COVID patients since March 2020, and this formula has remained completely effective regardless of the period. From May 2020, I gathered a small group from the students who graduated from New York College of Traditional Chinese Medicine. Our team has successfully treated 154 cases of COVID-positive patients to date. We do not fill patients' pulse this time because we treat patients by phone and the internet. The number of patients in our case series are still growing. The cure rate is 100%. This is the breakdown of expected treatment course. I would like to draw your attention to point 4 and 5 in the result. There has been no recurrence of COVID in patients on this formula. There have also been no new infections in patients taking this formula for prevention. Some additional notes. In our experience, raw herbs are stronger than granule powder. 庚子复养方 with small dose of 金匮肾气丸 confirms and prolongs 庚子复养方 effect. And from feedback, patients have no recurrences after taking our combination. This is an outline of our demographics. Majority of the cases last year were from New York. We also were able to treat 40 patients in Georgia, and the rest were distributed throughout the United States, like New Jersey, Pennsylvania, Connecticut, Virginia, Ohio, and Texas. Most patients who took 庚子复养方 were between 50 to 70 years old. The oldest patient we treated was 101 years old. The youngest patient who took this formula for prevention was 3 years old. It helps that this formula tastes a lot like juice due to the 大枣 and the 乌梅, so even children are able to tolerate and even enjoy their medicine. Since the 庚子复养方 has been published on WeChat official account of North America, we do not know the total number of people who took 庚子复养方. These 154 cases were from my team with some incomplete data. I appreciate Dr. Liu Xiaoji from Canada. He told me that he treated more than 10 cases COVID-positive patients with 庚子复养方. I have listed his cases below. There are some pitfalls to mention. Since Shaoyang, China is not involved, so Chai Hu Tang doctrine should not be used for treating COVID. It can worsen disease course and even lead pathogen into Shaoyin, China. The formulas with Huoxiang should be avoided in clinic because it dissipates yang qi and causes yang energy loss. Patients with yang deficiency are vulnerable to yin pathogen, so bitter and cold herbs should be avoided in COVID treatment. The fever with COVID infection is caused by yang energy deficiency and stagnation, not from heat pathogen. This is a common mistake and leads to many mistreatments. Antibiotics and antipyretics interfere with the effect of 庚子复养方. It can delay the recovery or worsen the disease course. I hope this presentation gives everyone a helpful insight into COVID and how to manage it. We welcome discussion and questions about 庚子复养方 and our experiences of treating COVID infection. My contact information is in the title slide. We are happy to offer help and advice. Thank you again to Traditional Medicine Forum for giving me the opportunity to share my findings.